Hi everyone, I'm Sia from Beautyologist, and today we're doing some Dermafrac training, but what I wanted to do is introduce you to Brooke from Advanced Skin Technology. Brooke is our trainer and will be explaining to us what Dermafrac actually is and how it works on the skin.
Yes, wonderful. Thank you for having me, Sia. So yes, today I want to talk to you about our treatment that we offer, which is called Dermafrac, which Beautyologist is going to be offering to their clients. So pretty much Dermafrac is a 4-in-1 treatment. It is 4 separate modalities that you might have had separately in the past, but we actually do them all together. So it's going to be microdermabrasion, it's then going to be microneedling with a simultaneous infusion, and then LED at the end. So all 4 of these modalities are done in around about a 45-minute to an hour treatment. But one of the best things is that there's actually no pain or no downtime associated with the treatment at all.
Weekend.
That we're going to be doing is our microneedling with infusion. So today for Sia we have chosen the Hydrate Serum, which is a hyaluronic acid based serum. So what we have here is we have first of all our little needle cartridge. So this is just a one-off use, it's not a reusable at all. So what we do is we're going to take it out of the packet here, and as you can see, it's just a little roller with all the little micro needles on it. So very, very fine, but that's what's going to be creating the channels into the skin. The other thing we have here is our Hydrate Serum. So this is a hyaluronic acid based serum, and what's actually going to happen with this is that the serum is going to coat those micro needles and actually infuse it into the skin as we roll along with those micro needles. Now, the idea of this is that it's about 7 mils of hyaluronic acid. By the end of the treatment, Sia's skin is going to feel dry to touch, but this cartridge is going to be empty. Now the idea is that instead of just putting the serum onto the skin, we're actually going to be infusing it into the skin. Now my advice to Sia post-treatment, depending on how long she would like her results to last, will depend on what she chooses to do at home with her home care. So I often like to use the analogy of our skin pre-treatment being like your kitchen sponge. When it's all dry, it goes quite hard and it kind of curls up a little bit, and as soon as you put water to it, it maintains that really nice rectangular shape and it's really nice and firm and plump. Now that is what the skin is going to be like after the treatment, but however long that sponge stays nice and firm and plump will depend on how often we re-wet the sponge. And in order to re-wet the sponge in the skin's case, I'm going to recommend a nice hyaluronic acid based serum for Sia to use at home to basically continue to re-wet that sponge to keep it nice and plump as the weeks go on. So I'm going to load up this treatment, and so we can start with the needling.
Yay!
How's that, Sia?
Yep, it feels good, providing it's getting overlapped.
Yep.
I can't see.
Okay.
That feels great.
Some of that damage. And the other thing that you need to do is do it quite slowly. So this is awesome for people who get lip filler, because again, it's hyaluronic that's going to be, drawing on that moisture. So if they do have filler, the Hydrate one's awesome to prolong their Botox. So have a look at that already. The difference in
Amazing.
That's awesome.
it's pretty great, isn't it? So then coming up to the eye area. Concluded the infusion and needling part of the treatment. So what I would like to show you, if you'd like to come a little bit closer, you'll be able to see Sia's skin. We haven't wiped it at all. This is just as is at the end of the treatment. It is actually completely dry to touch, so there's no serum or anything left on the surface. But if you have a look at our cartridge here, it is completely empty. So every last bit of that 7 mils of hyaluronic acid has ended up in Sia's skin rather than just on top of it. So really exciting that she's got that much of such an active ingredient within the live layers of her skin to be able to change the way her skin is functioning, help it to plump up, help it to hydrate, and help to stimulate collagen and elastin all at the same time. The fourth and final stage of our Dermafrac treatment is our LED. Now what we're going to be doing is we're going to be doing the treatment for 6 minutes, and it's going to be a flashing light. Now with our red light, we're looking at having an anti-inflammatory effect on the skin, so just helping to bring down any sort of erythema or redness that has occurred from the treatment, but also stimulating collagen and elastin within the skin. So what I'm going to be doing is I'm going to be hovering the handpiece just a couple of centimeters above Sia's skin, and the red light is going to be flashing and pulsing into the skin. It has a nice little fan action on it, so it is going to be feeling nice and cool on the skin, but it is quite a bright light, so we do get the client to wear goggles just for comfort purposes.